Thank you, Mr. Secretary, for being here. My district in Santa Clara County, California, has 11 cases now of coronavirus. And so I want to ask you a few questions to see how we can work together to solve this. That's the only thing that people care about. First, I'm concerned that CDC has stopped reporting the number of tests they're doing on their website. Do you know why that is? And can we get CDC to start reporting on their website again the total number of testing?
Well, I think that with the dispersal of testing to a lot of public health labs, and also the fact that we foresee an availability, as Commissioner Hahn has said, of a large number of tests being available from the private sector, we think that there are going to be a lot more testing going on with that particular.
But can we just have them report? I mean, we're the United States of America, not China. We believe in transparency and getting the facts out. Can we just make sure CDC is actually reporting the number of tests they're doing and all the information they have?
Work with CDC about exactly what they're bringing forward.
Thank you. If you could talk to them about the reporting. The second thing I don't understand, again, because we're the United States of America, is how have we only done 472 tests while South Korea has done 100,000 tests already, and Italy 23,000. I mean, we are the most innovative nation in the world. We have the most resources. How do we make sure that we're getting tests out there and leading in this?
In this case, there has been no backlog in terms of tests presented to CDC. So that's the good side, that we have not had backlogs. The number of tests, there have not been any delays in terms of tests being presented to CDC or backlogs of any kind. With regard to that, before the end of this week, as CDC has indicated, we should have public health labs throughout the country. We'll have those tests available, FDA-approved tests to get out there more broadly, locally. So that was as of last Friday. And as I said, Commissioner Hahn, working with private sector, believes that there will be many more.
Can we set a goal that we should be the #1 country in having more tests than any other country? I mean, it seems absurd that we couldn't lead in that.
I believe by Friday, we will see a substantial uptick in that. In many cases, what we also have to make sure is that we have accurate testing, that we make sure that, and CDC work closely with FDA to make sure that our tests were accurate.
And is there a reason we're not using the WHO test, the World Health Organization, that so many other countries are using?
Well, WHO is often relied on by countries that don't otherwise have resources in this area. Right. So many times we or countries will have our own tests for these particular.
But I mean, in this case, I mean, my view is we should just get the tests out there. Can we explore if that is something we should do? I mean, I agree we should be building our own tests, but if we can test more people, why not use that?
Well, we'll definitely take that back to CDC.
Great. The other issue is, can we assure people that the testing and the treatment will be free for anything related to the coronavirus?
I think when we get, for example, with regard to vaccines, our scientists have developed some of the intellectual property underlying the vaccines, and we will be negotiating with any private.
What about, I just see my time, what about the testing for coronavirus? If you want to get a test, you should have it free. If you want to get treated for coronavirus, that should be free.
I think if Congress intends to put that kind of that into the supplemental, we'll work with them.
Would you support something like that?
We'll work with all the particularities of exactly how Congress wants to do that funding. I'm assuming you all would have discussions amongst yourselves about how you would like to.
Do you think that may be a good idea?
Provide funding on that area. I'm not going to sort of second guess Congress on how you decide to allocate resources, whether it's to testing, vaccines, surveillance, personal protective equipment, therapeutics. We've got a lot of proposals on there, state and local support for responses. So there are a lot of elements to go into that. So I think we look forward to working with you all.
And my final question, just because of my time, I ran in actually at a coffee shop to Dr. Sanjay Gupta, and he raised an important point. He said that there are only 64 to 70,000 ventilators across the country. and that we may need more, especially as this is affecting the elderly. Has there been some concerted effort to make sure we're getting more ventilators in our hospitals and public facilities?
Yes, we've been talking extensively with the manufacturers of masks and ventilators to increase supply of them and other personal protective equipment.
If you could keep Congress apprised of what we're doing to get more ventilators across the country, that would be great.
Understood.
Thank you.